A woman is in labor. It is 20,000 years ago. The fire is low. Her mother is behind her. Another woman holds water. The baby is turned wrong, and everyone in the shelter knows what that can mean. Human birth made us smart. It also made us breakable. A human birth is not only biology. It is a room full of fear, skill, waiting, and hands. For much of human history, childbirth could take many hours, require other women, and kill mother or baby or both. Why us? Why did our species make birth so hard? One classic answer is a slow collision between two parts of our evolution that never quite agreed. Start with walking. Our ancestors became bipedal millions of years ago, well before they became smart. Walking upright reshaped the pelvis. The wide, flexible pelvis of a four-legged primate became the narrower, more vertical pelvis of a striding biped. This was great for walking, great for running, great for carrying things. Bad in one specific way for what was coming next. Then the brain grew. Smart, in evolutionary terms, means big-brained. Brains take up space, and brains are mostly built before birth. Over the last 2 million years, the average size of the human brain grew dramatically. By the time anatomically modern humans appear, the brain is roughly 3 times the size of our distant ancestors. A big brain in a baby that has to be born through a narrowed bipedal pelvis is, frankly, a problem. The baby's head is right at the edge of what can physically fit. Even now, even with modern medicine, this is the constraint that shapes human birth. The baby's head rotates. The baby's skull is not fully fused, with soft spots that allow the bones to flex. The mother's pelvis loosens hormonally before birth. Everything that can be done to make the passage a little bigger and the head a little smaller has been evolved, and it is still barely enough. One compromise was that human babies are born early in development. They are born helpless. They are not finished. Compared to many mammal newborns, a human baby is shockingly underdeveloped. A newborn deer can stand and walk within hours. A newborn human cannot hold up its own head for months. A baby chimpanzee can grip its mother's fur and ride along. A human baby cannot grip anything that matters. This is sometimes called the 4th trimester, a useful metaphor for how much growth happens after birth, not a settled explanation by itself. This made birth dangerous in ways every midwife learned to fear. The baby's head could simply be too large for the passage. Even with early birth, head rotation, and soft skull bones, obstructed labor could happen. The baby could not pass through. Without surgery, obstructed labor can kill both mother and child. Before modern medicine, there was often little to do. Some women survived. Many did not. Then came bleeding. The human placenta, by mammal standards, attaches deeply and aggressively to the uterine wall. When it detaches after birth, the wound can bleed massively. Postpartum hemorrhage is still one of the most common causes of maternal death in the world today. Ancient midwives knew this danger and developed many techniques to try to control it. Herbs, massage, positioning. They worked sometimes. They failed often. And after the birth came infection. The birth canal is not sterile. Torn tissue is vulnerable to bacteria. Puerperal fever, sometimes called childbed fever, killed enormous numbers of women in the centuries before germ theory and hand washing. It was especially deadly in early hospitals, where doctors moved between patients without cleaning their hands. Before that, the mother might survive the birth and die of fever 3 days later. Now, faced with this, you might wonder how the species kept going. The answer is that humans evolved one more thing to compensate: help. Unusually among mammals, humans often give birth socially. We do not usually give birth alone. In many documented traditional societies, women give birth with the help of other women, usually older, experienced midwives, often family members. The midwife knew what to do when the baby was turned wrong. The midwife knew which herbs to give. The midwife knew when to send for help, when to push harder, when to wait, when to act. This is a cultural adaptation as deep as any biological one. Solo birth has happened, but human birth has often been safer with experienced help nearby. Group birth is the human norm, and it is one of the reasons our species survived its own anatomy. Other women were the original obstetricians. Their hands were the original surgical tools. Their voices were the original anesthesia. Even with help, the death rates were brutal. In many pre-industrial societies, an estimated 1 in 50 to 1 in 100 births killed the mother. That sounds small until you remember that women might have 8 or 10 pregnancies in a lifetime. Over a lifetime, the cumulative risk of dying in childbirth could be 5 to 10% or higher. Infant deaths were higher still. A large fraction of all children did not survive the first year. Many parents lost half their children. The bones of ancient women sometimes show the cost. Pelvic damage from difficult births, skeletons of mothers with unborn babies still in place, cemeteries with disproportionate numbers of young women clustered in age ranges that match peak childbearing years. The compensations were also visible. Multi-generational households where older women cared for younger women, strong traditions of postpartum rest. Many cultures had specific recovery periods of weeks where new mothers did no other work. Specific foods, specific rituals, specific protections for both mother and baby. Naming ceremonies, often held weeks after birth, reflected the brutal reality that many babies did not survive the first weeks. You did not get a name until you had a chance to live. The modern transformation of birth, in places that have it, is staggering. Cesarean sections, blood transfusions, antibiotics, skilled prenatal care. The maternal death rate in wealthy countries is now a tiny fraction of what it was 200 years ago. The infant death rate is even lower. In most rich countries, parents now expect every child to live. This expectation is brand new. It would have been madness a few generations ago. But the danger has not disappeared. In parts of the world without reliable emergency obstetric care, maternal and infant death rates remain dangerously high. The progress is real, but uneven. The bipedal pelvis and the big brain are still doing what they have always done. The fix is technology, not anatomy. This is also why human babies feel the way they do. The total dependence, the constant need to be held, the crying that does not stop. That is not a baby being difficult. That is a baby finishing the trimester that the pelvis would not allow. The baby is, in a real sense, supposed to still be inside you, and it is calling for the substitute, your body, your warmth, your voice. The human baby is the price of the human brain. You are here because somewhere back in your line, every single ancestor of yours survived being born. Every single ancestor of yours who was a woman survived enough births to have children who survived. The chain is longer than any monument. The cost was paid in private rooms, beside fires, in caves and houses and fields. Most of those women have no names. They are why you are. What birth story does your family still tell? Share it in the comments if it is yours to share. Every ancestor survived being born. Most of them also had to survive sickness.